Hi, this is Sarah Radis, and I'm doing Quality Improvement Bedside Shift Report. Quality improvement is an important aspect in every healthcare affiliation. Bedside Shift Report is a major hit with quality improvement in healthcare facilities. Bedside Shift Report is key to patient safety, patient and nurse satisfaction, and nurse accountability and ownership. When it comes to the lack of bedside shift report, many issues and legalities can potentially arise from nurses not practicing bedside shift report. However, with strong leadership, evidence-based practice and research, and an implementation process, hospitals can implement bedside shift report and raise satisfaction in patient care and in work experience and increase ownership and accountability for nurses. Quality improvement is a systematic way healthcare organizations research and help improve the ways they deliver patient care. The quality improvement project I have chosen to research and implement is Bedside Shift Report. Many healthcare organizations already have this implemented, but many have not. Whether hospitals are already practicing this reporting or not, there's always room for improvement. Healthcare facilities such as hospitals can run into major issues if bedside shift report is not put into practice. Legalities, ethical occurrences, and medical adverse effects all have the potential to coincide with the absence of bedside shift report. For all staff, especially nurses, bedside shift report should be the first check of the day for the oncoming nurse. This allows the nurse to lay his eyes and see the status of the patient when coming onto the shift. Bedside shift report not only secures patient safety, but also gives the patient the opportunity to ask questions regarding their care and allows the nurse to verify information with the patient. To implement bedside shift report or any kind of quality improvement project, leadership must be strong. In a hospital setting, leadership always begins with hospital administrators. Hospital administrators evaluate floor performance, and if they see where a floor or a location is lacking, they may call for a change. After a change is needed and noted, clinical nurse leaders must begin the research to find a solution. For bedside shift report, the clinical nurse leader must then begin the implementation process and push for change with nurses by educating and explaining. Leadership is also within the nursing staff for bedside shift report. With bedside shift report, all nurses must communicate and work as a team to ensure that bedside shift report is done accurately and done to the best of its ability. Orfiata et al. States bedside shift report improves staff's teamwork by giving nurses the opportunity to work together at the bedside, ensuring accountability. Team building partnerships are all a part of the success when implementing the quality improvement project of bedside shift report. In the evidence-based practice research project by McAllen and his fellow researchers, he states that their research of the implementation of bedside shift report yielded a compliance rate of 94%, patient falls decreased by 24%, and it did not increase the average time spent giving shift report. Bedside shift report is viewed as a quality improvement project to help facilitate better communications between nurses, patients, and reduce errors. Steps for this process would have all the members be educated what bedside shift report is, and then after an understanding, whether it be PowerPoint presentation or just a round table discussion, all nurses and staff should have some kind of check-off to validate and ensure understanding. After ensuring everyone is on the same page, then comes a launch date for the undertaking of bedside shift report. During the launch, the nurse manager or nurse leader should ensure that the process is working well, smoothing out any issues and checking in with patients to ensure that nurses are cooperating in bedside shift report. Agency for Healthcare Research and Quality state that the nurse bedside shift report strategy is flexible, adaptable to any hospital environment and culture. Bedside shift report is flexible and it's easy to implement in each healthcare environment, making this quality improvement project great for all. Evaluation of the project will be left to the nurse managers, nurse leaders, and hospital administration. After a successful launch, nurse managers and nurse leaders should periodically check in with the nurses on the subject of bedside shift report, and also check in with patients regarding their satisfaction and if the nurses are still actively participating in bedside shift report. However, hospital administrations will probably see the best results after a good period of time. Hospital statistics should be evaluated and compared to before and after bedside shift report was implemented. In summary, bedside shift report is a great quality improvement project for any healthcare facility. Bedside shift report has many great benefits, such as increasing patient safety, improvement in patient-nurse communication, nurse accountability and ownership, and so much more. The lack of thereof can cause many issues, such as adverse medical effects, missed patient neurological and physical changes, safety issues, and many other preventable issues and errors.